Assalamualaikum and hi, my name is Fifi Nosharlina Mtisham. My message number is 14DKA 19F1186. My group member is Siti Nurfaiza binti Jarai and Afifa Natasha binti Dizuraini. Okay, today we want to present about depression. Depression is not just illness, neither is a choice or a weakness. Neither is it a choice or a weakness or something that can be seen. Our first love is interaction. Everyone experiences sadness and happiness at some point in their life. Clinical depression, however, is more intense and of longer duration than typical sadness or grief, which interferes with a person's ability to engage in daily activities. The symptoms of depression can include loss of interest or pleasure in previously enjoyable activity, major change in appetite, either significantly reduced or increased, sleep problems, sleeping too much or too little, a feeling of worthlessness or hopelessness, problem with concentration and making decisions, and throw off suicide. There are two main types of depression: major depression or major depressive disorder and discriminate disorder. A person diagnosed with major depression has experienced the previously mentioned symptoms of longer than 2 weeks. These symptoms either can occur repeatedly, called episodic, or only once, but they are typically served. A dysthymia diagnosis means that depressive symptoms are less severe and they have been present for at least 2 years or more days than not. Second slide is article. This is example of article about depression. This is pie chart of presented factor of depression. Depression does not only occur in adults but also in children. Depression can be considered a health problem, or it may can caused by an emotional disorder such as anxiety or distress. Feeling sad, having no enthusiasm, is no energy to do anything is one of the common feelings experienced by all individuals at one time. However, such feeling can be a long-lasting and less problem, or not worse, in left untreated by day by day. Clinical Pathology Department of Pediatric School of Medical Science, University Science Malaysia, USM, said Professor Dr. Aziza Othman said, seasonal or depression is experienced by various age, children, adults, and adults. Among the factors that can lead to depression are financial problems, unemployment, stress, and family problems, including divorce. Besides that, health-affected family history, environment, and abuse of illicit substances can also have a big impact on the mental health of children and adolescents. The percentage of factors in the community facing depression is 1.6% children, 10% adolescents, while adolescents facing depression is 21.2%. Finally, the percentage of normal is 67.2%, which is community that does not face depression in society. To address this problem, parents should spend more time to delve into the heart and feelings of children, or allocate at least an hour a day to talk to children for that purpose. He explained, Azaz said the lack of communication between parents and children made them less trusting that parents care about the problems they face.
Hi, my name is Afifa Natasha binti Dizraini. Registration number is 14DKA 19F1095. I am second presented. This is curve graph about symptom of depression. The symptoms that occur in children are feeling worthless. A child who has depression may feel that they are worthless or have no meaning in their life. They may believe that they are a burden to others, or that the world or their family is better off without them. The symptoms that occur in teenagers are feeling hopeless or helpless. Depression can make teenagers feel hopeless, as though there is no foreseeable end to how they are feeling. The teenagers may also feel helpless. They may say or think that no one can help them get better and that they will always feel depressed. The symptoms that occur in adults are feeling sad or empty. Mood change are one of the most common symptoms of depression. Adult who has depression may feel sad or down for long periods. Adults may also say that they feel empty or unable to feel joy or happiness. Some people may describe this sadness as despair.
Hi madam, my name is Siti Nurfaiza binti Jarai. I'm the last presenter and I will present about causes of depression. Depression in children can occur due to mental and emotional disorders. Many factors in behavioral change. Example, in 2019, we can see from this graph, the child has depression. This child lacks attention and parental love because their parents do not have time to spend with their child, only care about their work. In addition, by 2020, in May, 14 to 19 May depression in children increased by 4.6% due to sexuality or maybe done by others around the child. In the following month of December, 19 to 30 December, the percentage of child depression was 3% as children were abused by parents or parent guardians. In 2019, this percentage of 8.2% of adults nowadays become unemployed and lost their jobs, which leave them with no income to support their life until they suffer from depression. In 2020, in May, 14 to 19 May, depression adults due to their own employment problem. As an example, they do not achieve their goals in quality. Lastly, in December, 19 to 13 December 2020, adult depression occurred because the low paid are unable to support large family members. In addition, the reason for depression among teenagers is that in 2019, 28.2% of teenagers experience stress in education. Subsequently, in 2020, from 14 to 19 May, depression occurs among teenagers due to bullying and fights. Finally, in December, 19 to 30 December, depression occurs in teenagers increased by 33.9% because they experience a breakup with their lovers. In conclusion, depression is a treatable ailment like very many others. It is only fair that it is treated like other serious diseases and accorded the attention that it deserves. Among the age, depression is a more severe problem than it is among the young. It is a disease that continues to affect many more individuals without their knowledge. It strikes when it is too late and at a point whereby it requires a lot of support and very intensive treatment. The fact that depression in late adulthood can result in suicide, withdrawal, and social apathy should be enough to send the message that this is a dangerous disease. It is the duty of physicians the world over to step up their efforts in the fight against depression, particularly in late adulthood, through campaigns that will highlight the causes of depression, how can detect depression, as well as what measures can be taken to curb the development in depression. It is possible to deal with the menace that is depression in late adulthood.